What is depersonalization derealization disorder? In depersonalization derealization disorder, you feel detached from yourself, depersonalization, and disconnected from your environment, derealization. While feelings like this may come and go for many people, in people with depersonalization derealization disorder, they tend to last a long time, persist, or go away and come back, recur. Depersonalization affects your ability to recognize your thoughts, feelings, and body as your own. It might feel like you're watching yourself play a role in a movie rather than living your life. For example, if you're grocery shopping, you might feel like you're watching someone else push your cart, select food from the shelves, and go through the checkout line. Or you might not recognize your reflection in the glass doors of the frozen section. Derealization affects your ability to see your surroundings accurately. Things might not seem real, or you might feel like you're looking through a clouded window or in black and white rather than full color. Objects might look distorted in shape or size, or you may feel like they change while you look at them. Derealization and dissociative symptoms have been linked by some studies to various physiological and psychological differences in individuals and their environments. It was remarked that labile sleep-wake cycles, labile meaning more easily roused, with some distinct changes in sleep such as dreamlike states, hypnagogic, hypnopompic hallucinations, night terrors, and other disorders related to sleep could possibly be causative or improve symptoms to a degree. Derealization can also be a symptom of severe sleep disorders and mental disorders like depersonalization disorder, borderline personality disorder, bipolar disorder, schizophrenia, dissociative identity disorder, and other mental conditions. Cannabis, psychedelics, dissociatives, antidepressants, caffeine, nitrous oxide, albuterol, and nicotine can all produce feelings of derealization or sensations mimicking them, particularly when taken in excess. It can also result from alcohol withdrawal or benzodiazepine withdrawal. Tramadol withdrawal can also cause feelings of derealization, often alongside psychotic symptoms such as anxiety, paranoia, and hallucinations. In depersonalization derealization disorder, you may experience depersonalization derealization or both. But you haven't lost touch with reality. You understand that your perceptions aren't real, which can be frustrating and cause anxiety. How common is depersonalization derealization disorder? Most people know what it's like to be disconnected from time to time. This is called transient depersonalization. But depersonalization derealization disorder is long-lasting. It generally happens to 1% to 2% of people, though it's more common in adolescents, young adults, and people with other mental health conditions. What are the symptoms of depersonalization derealization disorder? People with depersonalization derealization disorder sometimes find it hard to put their symptoms into words. Others feel like they have words to describe their experience, but that people don't seem to understand them or take them seriously. But the main symptom of depersonalization derealization disorder is feeling disconnected. You might feel disconnected from your thoughts, feelings, and body, depersonalization. Disconnected from your surroundings or environment, derealization. Robot-like, or that those around you are robotic. Emotionally numb, like you're observing yourself from outside your body. Like you're living in a dream world, sad or anxious. These symptoms can cause significant distress, as you might start to wonder if there's something terribly wrong with you. You might focus on the symptoms. Think about your symptoms or past events over and over again, rumination, or try to control them. This can increase your feelings of anxiety and worry, which in turn may make your symptoms worse. What causes depersonalization derealization disorder? Healthcare providers don't know exactly what causes depersonalization derealization disorder, but it's often linked to intense stress or trauma, like physical abuse, domestic violence, witnessing or experiencing it, accidents or natural disasters, life-threatening danger, the sudden death of a loved one, a parent with severe mental illness. How is depersonalization derealization disorder treated? Researchers still aren't sure about the best way to treat depersonalization derealization disorder. When considering treatment options, your provider will talk with you about your medical history, your symptoms and treatment goals. They may recommend medication and talk therapy, psychotherapy like cognitive behavioral therapy, CBT, or eye movement desensitization processing, commonly called EMDR. Medications. Though talk therapy is the best treatment, your mental health care provider may recommend a medication or combination of medications as part of your treatment, like selective serotonin reuptake inhibitors, SSRIs, anti-anxiety medications, mood-stabilizing medications, antipsychotic medications. Side effects. Since mental health care providers may use different medications to treat depersonalization derealization disorder, the side effects vary, but there are some common side effects like constipation, dizziness, drowsiness, dry mouth, increased appetite, potential interaction with other prescribed medications, recreational drugs or alcohol, urinary retention, weight gain. If you have lasting symptoms of depersonalization derealization disorder, your priority should be to seek treatment from a mental health care professional. You'll likely need several visits initially, and then regular follow-ups with a psychologist and occasional follow-ups with a psychiatrist. Your psychiatrist helps find the right treatment for your specific situation and ensure that the side effects are manageable. Your psychologist will use talk therapy to teach you skills to cope with your symptoms and gain insight into your symptom triggers. In the meantime, take your medications as prescribed and try to be gentle with yourself. It's okay if you can't find words to accurately describe your experience. And while it's natural to worry about your health, try not to dwell on it. Paced breathing that involves a long exhale or meditation can calm your worries.